I completed a 4-year residency program in OBGYN, followed by a fellowship in reproductive endocrinology and infertility, and I'm boarded in both of those. Today, I wanted to talk about when to see a reproductive endocrinologist. So before you see reproductive endocrinologist, it's recommended that you see a clinician who specializes in obstetrics. One, to establish care, and to help optimize a healthy pregnancy. This clinician can help with preventative measures such as pap smears, mammograms, and vaccinations. This clinician can also help optimize health if there's underlying medical conditions such as diabetes or high blood pressure, where you would want to optimize control, or perhaps choose the medications that would be the safest to use in pregnancy. If patients have infertility, it's recommended that they see a reproductive endocrinologist if they've been trying to get pregnant for 1 year in women under 35, 6 months in women 35 to 40, and right away if women are over 40. And the reason why is because the chance of pregnancy declines in women with age, and that is because both the number of eggs decline. Women are born with a set number of eggs, and that declines throughout life. And also because as women age, the eggs become more likely to be abnormal, which leads to an increased chance of miscarriage. There's nothing that can prevent that decline in number of eggs other than freezing eggs. So there is a myth that if women are taking birth control, they might be able to preserve their eggs, but there's a continual decline during birth control. There's also a myth that if women use fertility drugs, that they're going to use up their eggs. There may be reasons to see a reproductive endocrinologist before the recommended timeline. For example, if there's a known fertility cause, such as irregular periods. Or some women may not want to attempt to get pregnant on their own, and they would like to do IVF and test for that genetic disorder prior to pregnancy to reduce the chance of having a child with that genetic disorder. Recurrent pregnancy loss, polycystic ovary syndrome, the desire to use donor gametes such as donor sperm, donor eggs, donor embryo. Someone may need a gestational carrier, have birth defects of the uterus.